YouTube, it's me, Sean. I am okay. I'm doing a video about what I bought. I spend too much money when I get back in school. What like I'm in school now, and I bought some things here that I want to show. I'm going to show you guys. Oh, okay. I bought this thing here. OB and GYN and PEDS notes. Davis notes. I could have bought it on my iPod, but you had to buy a subscription for the software I got. So Trey, stop it. So I had to I didn't have to, but I did. I bought this for like 27 bucks. Only because I can use it for this semester and my peds rotation. Because it has peds in here, newborn, postpartum, intrapartum, antepartum, and gynecology basics. So it's like a reference guide while I'm on the floor, even though I already have like a little cheat sheet. It's just more information. So, and you can write on it. And I figure since I want to go into like OB anyways, um, yeah, this will be handy. So, yeah, it's pretty cool. And then since I'm required to do 25 NCLEX questions, I got Saunders comprehensive review with the new test type questions, but you have to do 25 specific questions for each of my classes. So I got psych and OB. So I bought NCLEX 4000, which is at our bookstore too, or and on our computers at school. But since I don't stay on campus, I commute. I went ahead and bought it so now I can do it at home. And this is pretty cool because I've already like downloaded it and everything. What you do is you can set it to like study mode and or test mode. And in test mode, it won't tell you your answers or the answers and rationales like right away. It'll tell you at the end, and after it gives you like how many you got wrong or right. And what else does it do? That's the test. It has the alternate format, fill in the blank, drag and drop, and just like the it reflects what what the new test plan is like for the NCLEX. So yeah. So I got NCLEX 4000 and let's see, and this. And I'm going to get off here because I'm about to do my medication cards and study OB, and then I'm going to study psych tomorrow. And yeah, that's my study plan for the weekend. I'm kind of like in this funk about winter semester. I don't know, like I'm interested, but this always happens like during winter semester. I always have like something like this kind of, I don't know, sluggish type, I don't want to really do anything type of thing. So I'm trying to work through that right now. And yeah, that's pretty much it. I had my first OB clinical. It was just orientation. Seems like it'll be fun. Even though we have to do a lot of care plans, one for a mother, one for a baby, one for a mother and a baby, and then one for a special care unit. So it's going to be a lot of paperwork, and psych is going to be pretty, straightforward and to the point. So it's going to be interesting, but yeah, it's my first semester doing 8-hour clinicals, and I think I like the clinical part this time around more so than the class part. Well, I like OB class, but the psych class, we haven't really had a real class, so I guess I'll find out soon enough. And there's also like other little service things we have to do, like we have to like volunteer um, at a place that does like that helps the homeless and the needy, and we have to that's for psych, and for OB we have to attend the childbirth education class or breastfeeding or whatever. So yeah, those are the things that we have to do for that. And Yeah, I think I want to be an OB nurse, but psych and OB are specialties, and coming from like a med surg perspective, like I kind of like I like dealing with like disease intervention, fix problem, patient goes home. Even though the patients here in OB are like well, and for the most part, and you just they have their 3 days in or their labor part 3 days and then they're home, which is fine. But I think I like that. I like OB, but I like the whole med surge part. You have like 6 or 7 patients. You got this not wrong, and I kind of like I can wrap my mind around that. OB and psych is kind of like a different type of thinking. Your patient's medical diagnosis is not like your priority. Your priority is making sure her body's adjusting back to her pre-pregnant state the way it should be, and that she's bonding with her infant, and that her infant is okay, and he or she is developing well, or not developing, adjusting to extra uterine life well, and um, yeah, and that's you're just monitoring that interaction and that of their physiological, I can't talk, physiological symptoms, making sure they're adjusting well, and that's it. And you do your med paths, you see labor and delivery births, your C-sections and everything. Interesting, but like I said, I don't know. I think I like med surg because it was just like, okay, your patient has this, and that. I never heard of that. Oh my god, gotta go do some research. Okay, what interventions can be done for this? And you know, it's just different. Do your interventions, and then go back and reevaluate. Report any abnormals, um, and then change your care plan if you have to. And ultimately you see the difference like pretty quickly. In psych, you don't see as often, you don't see like the change in the person until like it'll be a while, it'll be like a small change. But in med surg you might see, okay, this happened, and then you did that intervention, and then boom, within an hour or a couple hours or whatever, that person has bounced back, or whatever the case may be. So I don't know. It's just my perspective right now. So, but I'm just starting in, so I'll let you guys know how it goes out, how everything pans out, and how I'm dealing with everything. Um, Stress wise, nursing school is a lot of stress right now, only because of the, um, you know, I gotta figure out how to study. I don't know how I'm going to study, which is driving me crazy. And because these questions are going to be application based, not so much knowledge based. So you have to like be able to apply what and not they're not going to just say, oh, this and that, pick A, B, or C to tell or to show your knowledge about that subject. You have to be able to get a patient scenario and apply it. So yeah, and my first test is coming up. So yeah, I'm getting off here and I'm gonna go study. I got a quiz and a test coming up soon, so I have to go now. But thanks for watching, thanks for subscribing, everybody, and I really appreciate it. And if I could give anybody any more insight on like nursing, like going through school, or what it's like, let me know. Alrighty, talk to you later.